Meanwhile, the Board of Healthcare Funders is calling for active participation in all processes involving the NHI Bill. Its Managing Director, Dr. Katlego Mothudi, joins us now. Dr. Mothudi, good evening. You represent, of course, the collective of medical schemes in South Africa and sub-Saharan South Africa. Your reaction to the form of the bill that has passed through Parliament yesterday?
Good evening, Kathy, and thanks for having us. We've been tracking the progression of the bill through the various discussions through the Parliamentary Portfolio Committee. We do know that many of the submissions that were levied through the process haven't found purchase in the bill that is now being published or voted upon by Parliament. We also do acknowledge that there is still an opportunity for stakeholders to participate in the bill. We also note that the process is still long. First, from the interrogation of the bill by various stakeholders, but also that when the bill has found assent to the presidency and been signed off, there's still a long process in terms of implementation and placement of various other elements, including the regulations.
What does that mean, Dr. Mothudi? Are you satisfied with the bill in its current form? Would you want to see it change going forward?
Our interrogation of the bill has always been that in its current form, it is not fit for purpose. We have noted a number of areas that we are concerned with, whether you're looking from how it's structured from a governance perspective. We've spoken about the various powers that are given to the minister and the board. Secondly, we have looked at other areas that might not be constitutional, whether you're looking at how the bill interacts with other statutes of legislation, the powers of the provinces that might be tampered with if it's implemented as it is. The rise of the practitioners, I think there's been a number of commentators on that, as well as the right to access healthcare by the health citizen. And this is very much in line with Section 33 of the bill that talks about medical aid schemes having limitations in terms of what services they can provide when the bill is implemented. So there are many areas where we think there could be revision and improvement.
There's been a general view that medical schemes are not supportive of the bill, that the minute the talk of a national health insurance started taking shape and form, at least as a policy direction, medical schemes have been up protesting against that. So just to clarify for us, is the issue around universal healthcare access, or is it about the national health insurance and the extent to which you believe the NHI may not necessarily lead to universal healthcare coverage?
There is no argument about the country needing a change towards universal health coverage, and we do acknowledge that it's also a process that would have to be progressive. However, with the bill as it's structured, we do not feel that it's, as I said, fit for that particular purpose. That's the first part. The second area that we've always commented is that having this bill being signed into law does not necessarily mean that we've achieved universal health coverage. There are many other elements that are required to fix the healthcare system. We've spoken about 5 other elements that the WHO itself recommends when you're restructuring your healthcare system that you must look at. NHI is only one of the 6. There's a financing component. You hear many commentators talking about the dire state of our healthcare system. When you look at the infrastructure, we've commented on the insufficient healthcare workforce that is currently deployed, and also that is being churned out by the various institutions that train them. We've spoken about the issues around leadership and governance which has also led to many complaints around mismanagement and, in some instances, corruption that has become a thorny issue in the system. So just looking at the bill itself does not bring a resolution to the challenges that we think our healthcare system is struggling with.
Is it not a starting point?
It is a starting point, but things must be done in tandem. Just signing this into bill and expecting everything to be fixed will not be the solution. The other issue that you asked, Kathy, was around the role of medical schemes or even the private sector. There's a lot of expertise, we believe, that rests within the private sector. Over many years of experience, that some of the functions of the fund we think would require administration services, managed care services, reimbursement arrangements, networking arrangements that medical aid schemes and administrators have been managing for years. And we are not in any way saying that the private sector medical scheme environment is perfect. It's also got challenges, as this was highlighted in the health market inquiry. But we think that when you're trying to fix the system, you must adopt a holistic approach, make sure that everything should be corrected, should be done that. And we already have certain templates. I've mentioned the WHO's framework. I've mentioned the health market inquiry report that have made very strong recommendations that assist the private sector to actually participate in healthcare.
How do you think that can be changed? Because I know that previously the private healthcare sector has sought the courts as a way of having its voice and its views on the NHI be considered.
There has been those instances, but even at our most recent conference that was held in Cape Town, the minister did allude to opportunities for dialogue. Now, at the moment, we're saying that the process is still long and there is opportunity for us as an industry to comment. You'll be aware that after this approval by the first house of Parliament, the discussions will then move towards the National Council of Provinces, where there will also be opportunities through formal submissions, town hall meetings, etc. Now, the Board of Healthcare Funders and other stakeholders are going to participate in those processes to try and assist the government in seeing other views. All right. We also are fortunate that we're coming from recent experience with COVID, where there was collaboration. And we think that those lessons must not be lost. And we should continue drawing from those lessons to make sure that we can rebuild the healthcare industry.
All right, so you'll wait it out a little bit longer and see then how far some of the submissions from industry, private, will be taken on board. Dr. Katlego Mothudi is the Managing Director of the Board of Healthcare